We're going to go ahead and get started. I wanted to welcome everyone to tonight's webinar. My name is Dr. Lauren Levine. I'm your moderator for this evening. We've got a great presentation and a great speaker. I've had the pleasure of moderating and hosting Dr. Kosinski a number of times in the past for his webinars. They're always well attended and we always get great feedback. We had a lot of people registered as of this morning. I see that most of you are logged in or logging in right now. I'm only going to speak for a couple of minutes. I want to make sure that Dr. Kosinski can talk for as long as he would like. As with all of our webinars, we encourage questions. On your screen, you have a GoToWebinar control panel. And as you think of the questions, go ahead and just type them in. I don't normally interrupt the speaker until they're done with their presentation, which is usually about 45 to 55 minutes, give or take. If there's something relevant to something he's got on the screen, I will do my best to get that question asked as quickly as possible. But type them in as you see them, and we'll typically get to them at the end in the order that they were asked. As with all of our webinars, we are recording this. So if for some reason you can't stay towards the end or get distracted, don't worry about it. We are recording everything. Usually the link will be sent out sometime in the next few days. If you want to get a copy of that, speak with your DenMat rep. Speaking of DenMat, thanks to them as always for their sponsorship of these webinars. I've had the pleasure of doing a number of webinars with them over the last year or so. Their commitment to dentistry is without question. They are always looking to provide great free content for people out there, as is evidenced by tonight's webinar. And thanks to them, it's, for any of you who have ever put together a webinar, it's not easy. We've got to send out the invitations. There's a lot that goes into planning it and promoting it. And thanks to them for making sure that we are able to do that. So without further ado, I wanted to introduce our special speaker this evening, who is Dr. Timothy Kosinski. He is an affiliated adjunct clinical professor at the University of Detroit Mercy School of Dentistry. He serves on the editorial review board of Reality and the Michigan Dental Association, and serves as the associate editor of the National AGD. He's past president of the Michigan Academy of General Dentistry. He got his DDS from the University of Detroit Mercy Dental School and a mastership in biochemistry from Wayne State University of Medicine, School of Medicine. He's a diplomat of the American Board of Oral Implantology and Implant Dentistry, the International Congress of Oral Implantologists, and the American Society of Osseointegration. He's a fellow of the American Academy of Implant Dentistry and received his mastership in the Academy of General Dentistry. Tim has received many honors, including fellowship in the American and International College of Dentists and the Academy of Dentistry International. He has placed over 14,000 dental implants and published over 190 articles on the surgical and prosthetic phases of implant dentistry. He's been a contributor to several textbooks, lectures extensively around the U.S. each year, so look for him at upcoming events that you may be attending, and he may be talking about that sometime this evening as well. So with that, Tim, we are looking forward, as always, to tonight's presentation.
Hey, Lauren. I hope you can hear me fine at this point. Yep. Welcome, everybody, for joining us on a Tuesday evening. We're here in Detroit, and it's a little overcast. Almost looks like it's going to rain, a little chilly, but we're inside, so it doesn't really matter. Lauren, we've been doing this together for a long time, and tonight's topic is really important to me in my practice. I've been doing dentistry, general dentistry, for a long time, and as you mentioned, I do a lot of dental implants, and I really believe in modern technology, and our diode laser that we're using, especially the one from DenMat, our sponsor tonight, is really special. And you can see in the photograph here, the instrument is in my right hand, and you can see it's almost the size of a Sharpie. So it's very, very convenient for me to use. And what I wanted to illustrate with our attendees today is the applications that I use in my practice. I think technology is very important, and we as dentists love technology. We embrace technology, but I think it's imperative that we spend our money wisely, and that when we purchase something, a new tool, that we're able to use it in the practice. And I can honestly tell you, Lauren, that this diode laser, between my hygienist and I, we use every single day in the practice, countless times. Just today, I had a patient that we had to uncover an implant, and we'll talk about that in a little bit. but that was on Eliquis and was not taken off his blood thinner. And that's fine. You know, go get the laser. It takes about 5 seconds for the staff to bring it to me to engage it. We do an uncovering without anesthesia. Without anesthesia, Lauren. That's to me is pretty amazing, and no bleeding. But we have a lot of applications for it that I think our listeners today will appreciate, and we'll take it from there. So today we're going to talk about the use of the diode laser, again from Denmed. It's called the NV Pro 3 diode laser, and it's a soft tissue laser. And I guess the question that we should begin with is how do you right now, our listeners right now, how do you manage soft tissue now? You know, if you do a crown preparation, I'm assuming that most of us would go ahead and use retraction cord. Most dental laboratories want us to do a dual retraction cord. And you know how challenging that can be sometimes and time consuming. In our practice, time is money. Oftentimes we will pick up a scalpel to uncover our implants or do crown lengthenings or other surgical procedures in our practice. And what we want to leave you with today is another tool, again, the diode laser, that again in my hand is about the size of a Sharpie. A pretty amazing piece of technology. It's cordless, very easy to transport from room to room. And the only downside of it is my hygienist and I wrestle over it. No, we don't physically wrestle over it, but we fight over it in its use, because she likes it in her hygiene room, and she certainly uses it for pocket elimination and other applications that we'll talk about today. So what we want to talk about tonight is how this particular diode laser can increase your efficiency in your practice. And increase efficiency is increase in revenue to your practice. Time is money in my practice. And also the positive response that you receive from your patients is probably the best marketing strategy that you can have. A happy patient that we don't harm is going to tell their family and friends about this new technology and this phenomenal dentist that's using it. And we're going to talk about some of the common dental procedures that I use instead of the more traditional methods, tissue punching. It's an adjunct to scaling and root planing. We even use it for herpetic lesions. And normally I wouldn't say this, but Lauren, you haven't seen me for a while, but I've grown a little goatee. And I noticed I thought I was getting a little cold sore on my upper lip. You know how that tingles a little bit and it's a little bit red and you start to lick it a little bit. And I looked in the mirror, and so I asked my hygienist, I said, let's do a biostimulation. We'll talk about that in a few minutes. And that was about 3 hours ago, and it's completely gone without touching it, a totally non-invasive procedure. And so we're going to be able to show you how you can integrate this diode laser technology in your office immediately. Here's my hygienist, Stephanie. Laser basics mean laser means light amplification by stimulated emission of radiation. And what does it do for us? Well, it does a lot of things. Again, it's a very soft, small piece of equipment, wireless. Very easy to use with preset settings. So the different applications that I'm going to demonstrate today are preset in the laser. So what can we do with it? We can cut efficiency. We can coagulate, no bleeding. As I mentioned, I did an uncovering of an implant today. We cut, we coagulated, no bleeding, no discomfort, no anesthetic. We can cauterize nerve endings. Our healing is fast. The discomfort that we create is minimal to non-existent. We can sterilize wound edges. There's different kind of lasers out there, and we don't have time tonight, Lauren, to go through all of them. But some lasers are hard tissue lasers, some are soft tissue lasers. And this particular laser is a gallium aluminum arsenic type of laser that is preset as at a particular wavelength in the visible light spectrum. It's in the 810 nanometer spectrum, which is a little bit different than some of the other diode lasers out there that are normally in the 980. And it's a very, very efficient laser to use every day. We have two basic settings with our laser, a continuous wave, and I think you can appreciate what that means. The energy is constant. So we have constant energy in a preset power wattage versus a pulse mode, which where the energy is actually kind of up and down. And I just wanted to show you, this is from northern Michigan, what I meant by a pulse mode, where we have this. I thought this was a cool picture to add to our program tonight of a woodpecker actually pulse moding, so to speak, and doing some pretty impressive artwork on a piece of lumber, and probably feeding him or herself with that energy. So quite an artist there. With our laser energy, 4 things can happen to laser energy when we use any type of laser. We can get reflected light, and that's why we wear protective eyewear whenever we're using a laser. The protective eyewear is for us, our assistant, anybody in the room, and the patient. We can get transmitted energy, which actually causes some burning. We don't really want a diode laser that is going to have a high level of transmitted energy. We can get scattered energy. We use that for biostimulation, and we'll talk about that for aphthous ulcers and lesions and things like that. And most of what I use our diode laser for is absorbed energy, and that is the cutting aspect of our diode laser, which is important. So that leads to cutting of our soft tissue. The diode laser energy is absorbed by several things. This particular diode laser, which is an 810 nanometer laser, is absorbed by hemoglobin, which is blood, melanin, so it works more efficiently in dark pigmented tissue, and water. The darker the pigmentation, calculus can be removed with our diode laser, or at least loosened with our diode laser. So it's a very effective use of the laser energy in very often in different applications in our dental practice. The laser is only attracted to soft tissue, is not absorbed by anything else. So it will not damage hard tissue such as bone or anything like that. So it's a very safe and effective means of treating our patients. When we're using a laser, we are creating heat, and with our laser, we're usually in the 100 to 150 degrees Celsius, which causes tissue vaporization, which is different than our more traditional electrosurge, which has a much higher thermal threshold, which causes burning, charring, blackening, and discomfort and pain. And you also cannot use an electrosurge on any metal objects. You can't use it around crowns, you can't use it around implants, you can't use it around dental fillings. So why do I use a laser? Why would I want to have this? As I said, it's a very convenient tool in my hands, so it's very beneficial. It does create revenue in the practice as far as our hygiene procedures and additional procedures that we're able to use. But even more importantly, our patient acceptance is incredible. It's a high-tech looking instrument. Patients are very impressed with it, and my clinical procedures time that I'm in the chair is reduced. That is an incredible revenue stream for me, in that I can do my treatment faster and easier to our patients. I can also move patients from hygiene, where they may be doing a scaling root planing and traditionally causing some bleeding. I can bring them into my operatory and do my clinical dentistry without having to worry about hemoglobin or bleeding to the sites that I need to work on. A happy patient will refer other happy patients, and I think it's the best way of marketing. We can see things. How many out there, as you're listening, have as simple as a class 5 composite? I did a sedation dentistry today where we did a lot of composite restorations. What do you do when you have bleeding in a class 5 restorations? The decay or the preparation is subgingival. How do you handle that now, doctors or hygienists out there? You can put a gauze or some kind of hemodynamic material on there, walk away, go have a cup of coffee, come back. Hopefully the preparation isn't discolored to some degree. Today, I would take out my diode laser, my NV3 Pro dental laser, which is very easy to bring to my operatory, and I'm able to cauterize the site, remove, vaporize the tissue without bleeding, and do an outstanding restoration. Treatment time, I think, is diminished incredibly. Although the dental laser is not like Star Wars, it's not real fast, it certainly is faster than me putting 2 cords of retraction cord and then walking away for 5 or 10 minutes before I take my final impression and hoping that I don't have more hemorrhage in the sulcular area. Especially those sites where access may be challenging or conventional retraction may be difficult. Short sulcus areas where placing cord is very challenging. And I think that we all agree as dentists that our dental laboratory, their biggest complaint with us is they can't read the margins that we create appropriately. So that in itself can reduce impression retakes, where we can see the margin completely with no bleeding. And obviously patient comfort is critical. When we're using our dental laser, there is minimal or no need for anesthetic. It depends how fast you want to go and what energy level you put it at. And post-operative discomfort is really minimized to a high degree. So we get very, very healthy tissue management certainly compared to a scalpel where we're cutting tissue, or electrosurge where we're harming the tissue to an nth degree. It also gives us a lot of predictability and as far as tissue health and tissue as the tissue heals, we don't expect a lot of tissue loss around our margins when we use the diode laser. So we get minimal bleeding, minimal postoperative discomfort, very, very fast healing, essentially no gingival recession. So in our aesthetic work, doctors, I think this is a very excellent tool. It's precise. The tip is very small, very narrow, which allows us to manage the site very well. We get no tissue scarring, and it is used by our hygienist very predictably in treating periodontal disease. We can eliminate pockets with our dental laser as opposed to using other chemical disinfectants, so to speak. So my results have been extremely predictable, and although it is an investment, the time saving determines an immediate return on the investment of this. You can do a lot of same-day dentistry using our diode laser, and as I said, this is a tool. We all love technology, but this is a tool that I essentially use every single day in my practice. So as you can see, it's the third time I've said this now, but it's very, very small, very compact, very portable, the size of a little bit bigger than a Sharpie. And it can cauterize the work area. We get no hemorrhage, rapid healing, no swelling in our surgical sites. DenMat does provide you several sets of protective eyewear. Again, you can move the patient from hygiene directly into our operatories to do same-day restorative dentistry without waiting for tissue healing, things like that, which is very, very efficient. I know in Detroit, and I'm sure it's the same around the country, the most valuable asset that our patients have today is their time. And we try to respect the time and do as much dentistry as possible to limit the number of visits that the patient needs to come to our practice. So these are all important things in my practice that I think have made me successful. Traditional ways, obviously a scalpel, which leaves open blood vessels and nerve endings on the edges of the wounds. If you cut into mucosa, you get prostaglandin, histamine release. You get a lot of discomfort using a scalpel. Blood filling into the surgical site can make making an impression for a dental implant challenging, and we'll talk about that. Oftentimes we need sutures when we use a scalpel. Nerve endings spill histamine, as I said, into the surgical site, resulting in inflammation and postoperative discomfort. A laser coagulates the blood vessels, cauterizes nerve ending, and sterilizes the wound edges. And this coagulation allows us to work in a dry field. So no sutures, no bleeding, very, very efficient. And we also stop histamine release so that we have a significant reduction in postoperative pain and inflammation, and we eliminate the chance of infection. What about root canal treatment? I'll use the diode laser to sterilize access at the pulp chambers. I will use it to treat a failing ailing implant to help sterilize the body of the implant itself, eliminating the inflammation and granulation tissue around an ailing implant. Electrosurge, I don't know how many of us use electrosurge anymore. Obviously, electrosurge is high energy. You can't use it around metal at all. It works very fast, but it also does a lot of damage. The damage with electrosurge, is near 300 to 500 cell thick, I think, where using our diode laser, our cell thickness that we actually vaporize is maybe 3 to 5 cells thick. So the effectiveness of our dental laser is awesome compared to an electrosurge. And again, you can't use it around metal, and causes postoperative discomfort, swelling, pain, and that's not good patient management in today's environment. You can't use it around metal, but you can use the dental laser, the diode laser, around crowns, bridges, fillings, and implants. And it's used in the treatment of our periodontal disease, which we'll show a little bit later. So electrosurge, zone of necrosis is significant, where with our dental laser, with this particular dental laser, we're talking 3 to 5 layers thick, which is non-consequential. So let's get to our clinical applications. That's why you're listening today. The FDA has cleared this dental laser for cellular debridement of diseased fibrous tissue, gingivectomies, gingivoplasties, lesion removals, herpetic lesions, aphthous ulcers, tongue bites, zits, all kinds of things. Fibromas, I'll use it to remove tissue tags, tissue retraction. Instead of using retraction cord, we'll call that troughing. Aphthous ulcers, any kind of hyperplastic gingival tissue removal, crown lengthening, frenectomies, and photocoagulation, elimination of bleeding in a clinical site. And as I said earlier, this particular laser, I like simplicity. And many of us have other lasers, or may have had other lasers in the practice, and they may end up in the corner of your room or in a drawer somewhere. And when something is complicated, it makes it challenging for us as dentists to use it. So what DenMed has done is created an instrument that is convenient, portable, wireless, but also has preset settings on it for the different procedures, and it actually reads out the procedures for you. So the learning curve of learning this particular laser is literally a matter of minutes, and we do hands-on programs. We'll talk about that later around the country, where we do work on pig jaws, and we go through the process. So by the end of that program, you're going to feel very, very comfortable using the laser in all different applications. So when we trough, we'll get a preset power setting of 1 watt. You can increase or decrease it. Again, the laser energy works on pigmentation, hemoglobin, melanin. So the darker the tissue, the more effective the cutting will be. When we talk about initiating a tip, it means what we do is I will take a little blue occlusal paper, and we actually, the very tip of it, we darken the tip, and that allows us to cut. That's called initiation. It kind of focuses the energy along the tip. When we're using this for bacterial reduction or aphthous ulcer or herpetic lesion treatment, we will use a non-initiated tip where the energy will be scattered off the end of the tip, and we'll discuss that in a little bit. Class 5 restorations, again, preset, gingival recontouring, frenectomies, implant recovery. All of these, when we're cutting, we're initiating the tip, meaning we're taking our blue occlusal paper, we're rubbing it activating the laser, rubbing it on there, and focusing the energy so that it will be more effective in cutting. We can remove, we can use it for biopsies and things like that. Periodontal treatment. I said my hygienists, Stephanie and Dana, love the laser. They use it frequently for pocket elimination. Laser-assisted periodontal therapy can be used as an adjunct to traditional scaling and root planing, and the laser energy selectively targets only darker necrotic tissue, and it leaves healthy tissue alone, which creates awesome healing. It's almost like magic. And you can, the dental hygienist can also perform a lot of other procedures, but depending on what state you're in, you really need to look at that as your state board laws in using a initiated tip versus a non-initiated tip. And DenMat can help you with that also as you're using it. But certainly, if the hygienist is not initiating the tip, scattering the energy for bacterial reduction, I believe that most hygienists can use that throughout the country. So a very, very great adjunct. And again, we have preset numbers that will tell us exactly how we're going to use that laser. For bacterial reduction, let's say we have a pocket depth of 6. How do you handle that now, doctors? How does your hygienist handle a 6 millimeter or 5 millimeter pocket right now, bleeding on probing? Acticite, chlorhexidine, referral, and I'm telling you that we've had great success with bacterial reduction in those sites, eliminating bleeding on probing and eliminating or reducing pocket depths from 6 or 5 to 3 and 2, very, very predictably. Cellular debridement, again, as an adjunct to conventional scaling and root planing, loosening the calculus, especially the dark calculus on root structures, without damaging the underlying hard tissue or bone to the site. Desensitization. What do we do in our practices now when a patient presents with a gingival recession and root exposure, and it hurts? Okay, most of us today, I mean, we have gluma, we have different procedures that may or may not work, Sensodyne toothpaste, and I'm telling you that we've had tremendous success, and I'll go through the procedure in a moment, on desensitizing root structures in one visit permanently. It's just an amazing piece of technology that you will find to be very, very useful in your practice. Other ones, the presets are incredible to me, and here's a list of, I don't have to go through it for expediency. I want to make sure we get through the clinical, but you can see all of the applications that we have with this particular laser without any thought process for us. It's all preset. It's just pressing an up or down button to determine what you want to do, and it'll be written in English. If you want to recover an implant, it'll say implant recovery. If you want to do laser troughing, it'll say laser troughing. It'll preset it. Now, you can also increase the wattage up or down to a certain level depending on the individual patient. So let's look at clinical. I think that's really important. That's what we want to see is clinical applications. For those of you who heard me before speak, you know, I'm a general dentist. I'm a very practical person, and I'm just going to show you what works in my hands. There's 100 ways of doing procedures, but all I can do is show you what makes me successful in my practice. So if we're going to trough, meaning instead of using retraction cord, we've prepared a tooth for a crown. We're going to go to laser troughing, which will have a preset of 1 watt. We can increase it to 1.4. It's going to be in a continuous wave, continuous energy, and we're going to initiate the tip, meaning we're going to focus the energy to the tip, which will allow us to cut. This will allow us to have predictable margins, no tissue recession, which is very important in the aesthetic zone. No bleeding, no discomfort. It's faster than putting 2 retraction cords, walking away and waiting for that to work. And it's more predictable. And then when we take a retraction cord off, oftentimes we still have bleeding. So it allows me to have very precise impressions, as you will see. Again, many of you have seen me speak before, or if you have, you know that in today's dentistry, we're preparing at or slightly subgingival. We really don't go subgingival very often unless we're, replacing an older crown or older bridge. And so the health of the tissue, the healing of the tissue is very, very important in the final crown fabrication so that margins aren't showing. And again, our applications are clear and crisp. And you might ask me what material this is. This is also a DenMat impression material, which I love. Very, very high quality, hydrophilic, different consistencies, extra light, heavy body, putty. So, and I don't know if they have any packages as far as impression material goes at the end of this program, but that's certainly something that you should discuss with your rep when you have a chance, because it's a very, very cost-effective impression material, very precise. So, just, showing here, we're doing laser troughing versus cord, and it can be challenging sometimes, especially when we don't have a large band of attached gingiva around that tooth. And as we said, we want predictable impressions without bleeding, without discomfort to the patient. If you had a root canal treated tooth, I can trough without anesthesia. That's an amazing thing for our patients today, not being able to, or to be able to do procedures without giving them a shot. I think that's a good marketing strategy. And we can get outstanding results. Here we have an old crown, and I want you to look at it closely, that there's recurrent decay. Look at the margins around it, very typical of what we see in our practice today. And we remove the crown, and we're simply going to use our laser. Now, this photograph I wanted to put on here, it's called a Firefly. I don't know if you've seen it or not, but it's a little headband with a very, very intense light. I know many of us use loupes when we're working with a light, but oftentimes I will do my implant procedures without loupes because I want to see the whole focus of the patient. I want to see their reactions, and I want to see the entire mouth area. So this Firefly is a very intense light. It's awesome. Another DenMat product that you may want to look into that helps me visualize the situation very, very efficiently and effectively. So here again, let's do laser troughing. So we have our little pen diode laser NV Pro 3, and we turn it on, and we go through procedures, and it says laser troughing. I will press enter again, and it presets to 1 watt. It is ready to go now. I will take blue occlusal paper, and I'm initiating the tip. I'm simply rubbing the laser as I'm running it, and we're charring the tip to focus that energy, which will allow me to cut very efficiently. And we had our preparation of that crown we removed, and you can see I'm placing the laser slightly subgingival, and you can see how the light is penetrating through the tissue, and it's actually vaporizing the tissue. I'm going to keep going around very slowly. It's not fast, but it's going to eliminate bleeding to a high degree, and you'll actually physically see the margin without using retraction cord. And here's I'm using my DenMat material in our site, and I don't know if many of you know that DenMat is also a very, very excellent dental lab. You may remember Lumineers or are using Lumineers, and they are a very, very high quality dental lab, and they fabricate some beautiful aesthetic dentistry for me. And you can see the seating in 2 weeks of this crown and the health of the tissue and the margin using the dental laser. I don't have to concern myself with gingival recession prior to seating this crown. So again, time is money. I want things that are gonna go well, no bleeding, good impressions, easy seating of my restorations, and a high quality product that my patients will appreciate over time. So what we're going to do, as I mentioned, when we're troughing, we're going to initiate the tip. We're going to set the laser power to 1 to 1.4 watts in a continuous waveform. It's all preset. We're going to insert the tip approximately 1 millimeter below the hard tissue. The laser tip is placed parallel to the long axis of the tooth, between the tooth and the sulcus, and we continue circumferentially around the tooth or until the area is needed to be exposed and the margins and hemostasis is achieved. I will then take some hydrogen peroxide on a Q-tip and kind of rub the area to remove any discolored area, or sometimes we do char the tissue a little bit. We want to remove that charring so we can see the margins very, very clearly. And the procedure is complete when you can clearly see that the hard and soft tissue margins have been cleared away and bleeding is controlled. Very efficient, very effective way of using this dental laser. Now, we do want to use the optimum power for each individual situation. And again, pigmentation is very important, melanin, hemoglobin. That's how this particular laser works in the 810 nanometer range in the visible light spectrum. So if you have a patient that has a dark pigmentation gingiva, it's going to work more effectively than somebody who has very light pink gingiva. Give the laser a second to fire up before starting with a slow brushing stroke. All lasers are built with a slight firing delay. And be sure the laser power is delivered in the continuous mode for cutting, not in the pulse mode, which we'll use for biostimulation. Initiate the tip, and you're blowing air or putting high volume suction in the area because you are vaporizing tissue and there will be a little bit of an odor there. It's not overwhelming, but just be conscious of that. And we want to use the correct power setting and a light stroke. When you do this, you don't need anesthetic. We need anesthetic when we want to go fast, when we hold the energy level too long at a particular part on the soft tissue, or we put the power level too high. I know as dentists, we like to do things fast. It's not an electrosurge, doctors. It's a slow process. So once you get in the hang of it, I know when I first started using it, I wanted to go faster and I was charring the tissue a little bit more than I should. But now that I've become very proficient at it, really I can control the energy level and the results to a high degree. If the patient ever complains about gingival recession, then the power level was just too high or you're moving the laser too fast. And you don't want to char, meaning brown or blacken the tissue. That's causing damage to the collateral tissue, which we don't need to do when we're using the tool properly. All right, so let's look at another tooth, a bicuspid tooth that we are going to prepare. And we're going to initiate our tip. We're going to go ahead and use the laser around the margin of the tooth very slowly. Once we can see the margins in total, I'll use my DenMat light body material and our DenMat putty material, and we get a clean, healthy impression, which the dental laboratory appreciates. Here, the patient returned in 3 weeks, and the DenMat crown that was provided gave us a happy, proficient patient, time-saving, very efficient use of our clinical chair time. Another use of diode laser for troughing versus retraction cord. Same patient, different sides of the mouth. I just wanted to demonstrate our preparations, removing the old crowns with decay. In a matter of minutes, we can laser trough with no bleeding. I can see the margins, as opposed to retraction cord, a double retraction cord, a lot of bleeding, having to wait for hemostasis. But our techniques have worked well, and certainly we get equally good impressions. The laser technique was more efficient, more time-saving for us. I wanted to demonstrate this. This was a really awesome case that I thought it was an awesome case, maxillary anterior case. And DenMat also, I know this is a laser program, but I just want to touch base on several applications that I think are just awesome. It's called LumaSmile. For those of you who have not heard of it before, I want you to at least ask your DenMat rep about it. how do we now tell our patients, when we talk about aesthetic dentistry, doctor, I don't like my smile, you know, I want veneers or I want crowns or whatever. What do we do now? How do we show them what they're going to look like? Well, most of us, including myself, would take an impression, do a diagnostic wax up, do a digital wax up, bring the patient back, show them the stone models, maybe give them the stone models to take home to their family. But do our patients really understand what that is? Do they really get it? Do we show them before and after photos of patients that we've done in the past? Well, certainly that's a strategy. This Luma Smile is incredible. I remember years ago when I was a young man, or when computers first came out, we evaluated a big old computer where you would take photographs and we could manipulate them to try to demonstrate the final result. The problem with that, and the reason I think that it faded away, was we really didn't achieve what we promised the patient. Well, this Luma Smile is pretty awesome. We have a patient that, young woman, very in her 20s, new mom, neglected her teeth and wanted a smile. She wanted to start with the maxilla and right and left. And what we simply did is I took my iPhone and I take a snapshot of her smile. I take a snapshot of her smile, and it's an app. It's an app on my iPhone. You purchase this app, and I send it to DenMat, and within 20 minutes, this is what they provided me. This is what they provided the patient via text or email. This patient sat in the chair. I didn't have to bring him back. My chair time is valuable, very valuable. She was so excited. She was texting her husband, her mom, her sisters about what could be done. This was a motivator beyond motivators. Obviously, this is just a digital, virtual design of what the DenMat lab was going to create for our patient. We prepared the teeth, and I used the laser to trough around the teeth. We did this in sections. We did the anterior, and then we did the bicuspids later. And we got a nice clean impression using our laser without bleeding. The laboratory had a very quick turnaround time and provided me the results that they had promised in the beginning. This is immediate seating. The patient was thrilled with the results in the final restoration. So again, tools, technology is important to us, but technology that we can use in our practice to build our practice, to make us better practitioners, are important things. To buy things that we don't use is silly, but to buy things that help us elevate our clinical skills to a high level, I think is worth every dime. So they did a beautiful job for me. I'm very proud to be associated with DenMat, and they can certainly, and this is, we brought the patient back a couple weeks later, the lower slide, and you can see the before and after final results that were created. Gingivectomies, we can use it for simple soft tissue, not true crown lengthening. We're not removing hard tissue. Remember, this is just a soft tissue, but to balance the gingival contours around the tooth, again, we're cutting. We will not get a significant tissue recession. There's no bleeding, no discomfort, and the patient will heal when we bring them back in a couple weeks, and you can see the results that we can achieve. It creates symmetry. Frenectomies can be tough. How do you do frenectomies, especially on children? I mean, our orthodontists send us frenectomies all the time before they put brackets on. It can be painful to the child or the adult. We have to use anesthetic. You know, I would use some kind of retraction. We would suture or refer it out. And with our laser, with our dial laser, it's a soft tissue laser, we can basically, if we go slow enough, do it without anesthetic or minimal or just topical anesthetic, and no sutures, no bleeding afterwards. So let's just show you an anterior case. Here you can see we had some preparations, and we have a frenum that was going to interfere with my conventional bridge. And what I simply did was set the NV Pro 3 laser, diode laser, to frenectomy, press enter again. It's set at 1.2 watts, and I'm able to very efficiently and effectively cauterize or vaporize that tissue to a high degree to remove that tissue pull from my surgical site. Very, very efficient, very effective, and very fast healing. Remember, it's cauterizing the nerve endings also. So we don't have excessive bleeding in the site, and allows me to see the area very efficiently. And 3 weeks later, you can see the control that we had of that tissue in doing the frenectomy. Implant recovery, I'm going to go a little bit quicker here, I think is important. Again, you're cutting. You can use it around implants. We're not going to heat the implant. We're not going to damage the implant. And as I said in the very beginning of the program when we met an hour ago, patients on blood thinners didn't go off the blood thinner. I didn't use any anesthetic, and I'm able to recover the implants quite efficiently, quite effectively using our dental laser, which allows us a nice healthy response, especially in the aesthetic zone where we don't want recession. How do you handle this now, doctor, in your practice? Many of us would take a tissue punch or a scalpel or a high-speed, a round burr. Careful, don't damage that top of that implant. And if we have a lot of bleeding, are we really getting a good impression? Are you having issues with the final seating of your implant retained crowns because of bleeding? Are you having issues in the aesthetic zone? Are your abutment margins showing? Are you showing metal because of gingival recession? We're not going to see that with our dental laser. Another situation where we're going to uncover the implant that we had placed. Again, preset, it says implant recovery. Press enter again, it gives me 1.2 watts. I'm going to initiate my tip. And I'm simply going to remove the tissue over the top of the implant without any anesthetic. Great marketing strategy for our patients. No bleeding. I'm able to remove the cover screw, and I'm able to make a clean impression using my impression transfer assembly or impression coping to the site. I'm using my DenMat material, my extra light material. This is called a mirror tray, which I often use for my open tray techniques, using the DenMat putty material. Immediately following treatment, I'm able to put a healing abutment on and look at the tissue health that's created when I'm going to seat this restoration. Here it happened to be 4 weeks later as the patient was out of town. But you get nice tissue cuff. You don't get gingival recession on the facial aspect. I have good tissue control. I've attached gingiva on the facial aspect of my implant, and we're going to give the patient a really nice restoration. Thank you, DenMat, for providing these tools. Full arch here, we have implants, and I'm going to uncover some of the implants. So again, we're seeing where the implant is. I'm going to use my laser to uncover without bleeding. Take hydrogen peroxide, remove the cover screw, put a healing abutment in. Versus more traditional tissue punching, cutting the tissue, we get a lot of bleeding in that area, which makes making an impression more challenging. And certainly you have to anesthetize the patient if you're going to cut them. So you can see the applications are incredible. Very, very important. Look at the posterior implant on the left where there's heavy bleeding, and then the 1 week post-op of the healing abutment. In the anterior implant, we do not see tissue resorption or tissue recession. In the posterior, we see probably 1 millimeter, maybe 1.5 millimeters of tissue recession. It's a physiologic response. So again, this is a tool that will make us not only more efficient, but will give us better long-term results, especially in the aesthetic zone. Biostimulation, I think, is just cool. You know, this is one of those marketing strategies that I didn't even realize. Here, we're not going to initiate the tip because we're not cutting. We're not even touching the lesion, called low-level laser rate therapy. We increase circulation, collagen formation, osteoblastic activity, and fibroblastic activity with these things. So we're actually scattering the energy in a non-initiated, non-contact application. It's called biostimulation. We can use it for laser bacterial reduction, aphthous ulcers, and canker sores. When we cut, we already talked about when we're using it to cut. So let's look at canker sores. Preset, it'll say aphthous ulcer. What it does is it kills bacteria. There's no discomfort. As I said, my hygienist did it on my lip today. I felt nothing, maybe a little warm, maybe a little tingle. It didn't hurt at all. And the faster you can get it in, if you have patients or if you know in your family that gets herpetic lesions, cold sores, once you start to feel that tingle, get them in right away. It takes 30 seconds to treat the patient with no anesthetic. The results are amazing. This canker sore is biostimulated 1 week post-op. It's gone. The patients love this. They market it for us. A herpetic lesion, again, preset, immediately following treatment. It doesn't really look any different. You don't touch the lesion at all. They feel a tingle 1 week post-op. It's gone. So the embarrassment of a cold sore, the pain and discomfort of a cold sore, how it affects our social life. You can't kiss, you can't do a lot of things. Our patients are very responsive to this and very appreciative, and you can charge for this, okay? And it's very worthwhile. Very painful herpetic lesion. Preset to aphthous ulcer, pulse wave, 1.4 watts, never touching it. What I do is I go around the lesion probably for maybe 15 seconds, 3 times on the outer borders to the internal design of the lesion. You can see I'm not touching it. 1 week post-op, it's gone. So we don't have the dryness, the hurting, the pain. Another lesion on the lip, 1 week post-op, it's gone. Angular colitis, in Michigan, when patients are overclosed, saliva can be very, very painful. How do we handle that before? Vaseline, different lotions. Again, I'm going to biostimulate that area, not touching, and it's gone. Mucoseals. Again, a mucosal, I want to remove it, so I'm actually cutting the lesion, and it's gone. A tongue lesion, a bite mark on the patient. Amazing. Just amazing. Here we measured it, biostimulated it, 1 week post-op, 4 days, 4-day post-op, it's gone. Our patients are so responsive to this treatment. They get excited about laser dentistry, which is the best marketing strategy. I want to finish up in the next few minutes with periodontal therapy, scaling and root planing, antibiotic. How many do we eat now? How do we treat pockets? Scaling and root planing, antibiotic treatment like Arrestin, which in our hands is non-predictable. We can refer to the periodontist for surgical intervention. Laser-assisted periodontal therapy with our NV Pro 3 diode laser. We can use it in conjunction with scaling and root planing. We can eliminate pockets very, very predictably. We can help in scaling and root planing. We can debride the sulcus, which is called laser curettage. We can remove that dead tissue, which allows for a much healthier final situation. Very effectively and efficiently. So let's look at bacterial reduction. We're going to not initiate the tip. It's not cutting. It's going to reduce the bacteria in pockets, reduces risk of bacteria entering the bloodstream, no anesthetic, improve effectiveness of our laser-assisted periodontal therapy. It can even soften calculus deposits. You can see here our situation where we have bleeding on probing, a deep pocket. We're using a non-initiated pulse mode tip. We're not cutting, and we're bringing back the patient in 3 weeks. And for demonstration, I wanted to show how the pockets were essentially eliminated and there's no bleeding on probing. It's not magic, it's physiologic. Continuous mode, the setting is half of the pulse mode. And again, we talked about continuous versus pulse in the very beginning, continuous energy versus on and off energy. The It's a matter of a few moments to be able to treat the patient, and we're using a non-initiated tip that most hygienists can use very efficiently. So again, measuring pockets, bleeding on probing versus a healthy cellular area using our laser. 3-week post-op, from bleeding on probing to a healthy pocket situation. Our patients have been very responsive to this deep pocket laser therapy to elimination of pocket very, very predictably. In almost every situation, you're going to get a result. And you can see why my hygienists, both hygienists, Stephanie and Dana, are so excited about this. Tissue overgrowth around the areas is a very simple area to clean, remove, selectively remove disease epithelium. Doesn't harm healthy tissue, allows the healthy tissue to regenerate. We get consistent reduction of pockets that are 6 millimeters or more to 2 and 3 millimeters, and our patient response has been exciting. No anesthetic oftentimes. This is an interesting case. This is an old blade implant that we had done, that an elderly patient that had tremendous inflammation, bleeding and probing, sore. I said, you know what, Sherry, go get the laser. Let's try this. So we used it, and you can see the elimination of the pocket with no bleeding and probing. The patient was thrilled. Desensitization we talked about. Again, we're not cutting. We're going to put a little bit of a layer of fluoride varnish to the sensitive area, and we're going to biostimulate. We're not cutting. We're not touching the area, which occludes the varnish into the dental tubules, and we eliminate hot and cold sensitivity immediately. Immediately. That is a marketing strategy that we have not been able to use in our practice up to this point. Very, very exciting. So here we're using the Prevident varnish to the site, to root sensitivity, and it works very well. There are insurance codes that that we can provide you, that DenMat can provide you, and the charges, normal charges around the country. And you can certainly see with all the procedures that I demonstrated tonight that this instrument will pay for itself in a very short amount of time. And I challenge you, most of you in your busy practices will have one in the hygiene room and one with the doctor, because it's something that we use all the time. So you get unmatched value. It's simple, plug and play, 12 presets, size of a Sharpie essentially, very easy to move around. You don't have to plug it in, no cords, there's no what is the setting again? Oh my gosh, I can't remember. It's not complex, it's simple. With enough high wattage to use efficiently as a soft tissue laser. In our courses, we do pig jaws, and so we'll give you the opportunity in our full day courses to use the laser on tissue, and you'll be able to see all the applications. DenMat was kind enough to give some specials. I am going to be lecturing at the end of June in Fairfax, Virginia at the Marriott at Fair Oaks, and also in Atlanta, Georgia on July 12th. I think we have maybe 4 or 5 more courses throughout the country that you can talk to your DenMat rep about, but these are the next 2. And for those of you who were kind enough to bear with me for an hour today, they are giving you a $200 discount on the webinar, I'm sorry, on the course tuition, and also team members have a discount. I love, I do a lot of implant training, a lot of grafting training. I love when doctors bring their staff, because I think that makes us more efficient when we get back to the practice. So I hope to see some of you soon. I hope you enjoyed the hour. And Lauren, I'm going to give it back to you to see if there's any questions that may have been that need to be addressed.
Well, we definitely have some questions. So thank you, Tim. Always a great presentation, and we've got some questions for you. So hopefully you can stick around for a little bit.
Absolutely.
Okay, what settings are used with the diode laser for different procedures? It's maybe kind of a long question since there's different types of procedures.
I think the settings are preset. We can go from from like 0.4 watts to 3 watts. And again, the setting that you put it on is really dictated by the patient, the pigmentation itself. So what I will do is I just go right to the presetting, and I see how it works. And if I have somebody who has light colored gingiva, I may have to increase the setting to make it more efficient. The key to that question is you have to keep it moving constantly. You want to spread the energy around even when you're cutting, and you don't want to char or burn the tissue. And if you find that you're charring or burning the tissue, you just bring the wattage down, okay? When you're charring the tissue, you're doing more damage, and you're not going to necessarily get the same result with elimination of recession and things like that. So I think that's the key to that answer.
Okay, well, there is actually another question about that, and I guess you've already answered it. Is charring the tissue appropriate, and how is it controlled?
It's controlled by decreasing the wattage, and you don't want to char. Because you know, if you're charring, the patient's going to feel it, and you're going to have to anesthetize the patient. I love doing procedures. If I have a root canal tooth that I prepared, it's cool not to have to, well, you don't have to numb it for the tooth, you're just numbing it for the tissue because you have to do the darn retraction cord. It's nice when we don't have to numb our patients. They really appreciate it.
Yep. Any concern with recession when you're troughing the tissue?
You know what? Again, when the setting is done correctly, I'm not concerned with that at all, because I don't see recession with that. I showed you a couple cases where the sulcus was very, very shallow, and yet I didn't get any margin showing on my final crown.
Okay. Does the diode laser affect bone at all?
Doesn't affect hard tissue whatsoever. This is simply a soft tissue laser.
Okay. Question about the, you mentioned about the bacteria kill with a non-initiated tip. How does that actually work, and can you really sterilize with the laser? And is there any evidence out there, any papers, or what should someone look for if they want to get more information about that?
Yeah, I think if you want specifics, I think you should talk to the DenMat rep, and I'm sure they'd be happy to, I think they would be happy to provide that specific documentation. I can tell you that clinically in our practice, we are seeing routinely and predictably pocket elimination with a very non-invasive procedure that the patients have responded to immensely. Periodontal, traditional or conventional periodontal surgical procedures are certainly an option for us, but it's nice to go through all the procedures to see if we can eliminate the bleeding and the pocket depth with non-invasive procedures. So what causes bleeding? What causes gingival inflammation? It's bacteria, and eliminating that bacteria. I also use it around, as I said, some of our ailing implants. Let's not call them failing, let's call them ailing, where we have some bone loss around the implant, and I want to either graft or reposition tissue around that, and I will use it to clean out all the granulation tissue and reduce the negative bacterial count around those implants and those sites.
Sure. How about biostimulation? How does that work?
Well, again, it's as as we mentioned in the lecture, it's actually killing the virus, and there are and again, DenMat can provide the clinical information. It's actually killing the virus, and the literature is saying, Lauren, it's kind of interesting. As I said, I had one coming right on my upper lip, and I don't feel it at all right now, and that was just like 5 hours ago. So it's actually killing the virus, and the literature will say that the lesion will not come back in that same site. It's pretty amazing. It's like it's magic.
Okay, let's see. I think we got one or two more questions here. There's different types of lasers. There's 980s and 810s. What's the difference between those different types of diode lasers?
Yeah, well, and that's a great question. There really is no significant clinical difference between the 810 and the 980. The 980 doesn't cut quite as deep. They say it's maybe 2 to 3 cell layers deep, where I said this particular laser maybe 3 to 5 cell layers thick, so really insignificant. But with the 980 lasers, you need copious amounts of water with it, okay, which is a little bit more difficult for me to use, or that's what we had in the past. And I think this is just a more convenient. I don't have to constantly irrigate with water with the 810 diode laser.
The settings that you talked about, would those be relevant for? I think Denmat had a laser called the SOL SOL before. Are they similar settings for that one?
You know, it's just a little bit different. The SOL is a great laser, and we've had it in our practice for a long time. It's a little more inconvenient because you have to, you know, plug it in. You have to. There's a cord, and doesn't have as many presets on it. A little bit different. It's not exactly the same, but very similar.
Okay. Well, we're out of questions. So,
awesome.
Anything you'd like to say before we wrap? Oh, there's another one here. Yeah. Okay. So, I know you had mentioned that we can the DenMat, but I have the question from the person who was asking specifically about the sterilizing evidence, and I'll make sure that DenMat gets their information so that they can forward along that to them.
Right. So, I think there's a phone number at the end of the slide, 800-433-6628. And you can get in contact with the DenMat rep, and I'm sure they'd be able to provide that specific information. I'm giving you my clinical experience with it. It's awesome. And thank you, Lauren, again. It's always a pleasure being with you. You're a scholar and a gentleman and a friend, and I appreciate your taking the time to promote the profession to such a high level.
Well, thank you, Tim, and thank you, to all of you for joining us this evening. We know your time is valuable. We definitely give a lot of thanks to DenMat, as I mentioned earlier. They're really committed to dental education, and the fact that they, every month or two we seem to have just fantastic speakers and great content, and we're getting a lot of good feedback from people as well. Tim, thank you as always. Every time I watch your presentations, you're showing new information, new material. Nothing's being regurgitated here, so I'm learning something new every time, and hopefully everyone that's on is getting something out of it as well. Take advantage of the webinar pricing that Tim is showing there for the courses that are upcoming. I think this is a great opportunity to really add some new skills and new procedures to your practice, and obviously affect the bottom line as well. We do these webinars on a regular basis. I'm not sure when the next one is, probably in the next month or so, but stay tuned. You're all on the mailing list, and we'll be sending invitations when the next ones are coming up. So thanks again to everyone for joining us, and we look forward to seeing you all on future webinars. Good night, everyone.
Good night, Lauren.